Okay, I'm gonna call this Board of Health monthly meeting to order for Wednesday, July 9th at 5 p.m. Amy, could you call the roll, please?
Danielle Chenoweth.
Present.
Jennifer Locke.
Here.
Kyle Patterson.
Here.
Next, I'll entertain approval of the agenda.
So moved.
A second.
We have a motion and second. Any additions, discussion? All those in favor say aye or do the wave.
Aye.
Aye.
Approval of minutes of previous meetings. I'd entertain a motion for June 16th, 2025 public hearing and monthly meeting minutes.
So moved.
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have public participation. Okay. Next, correspondence from our administrator.
Well, I sort of have correspondence, but it's not fully formed yet, but I just want to let everybody know that the state of Illinois is going to be following the science when it comes to vaccine recommendations.
Thank you.
So they will not be following some of the weird stuff that might be coming out from CDC this year. So ACIP, the group, is reassembled at CIDREP in University of Minnesota, and they will be continuing to review the literature like they always do and the studies, and they will be making recommendations, and it would seem, I didn't see you come in, and it would seem that the state of Illinois will be following that, which is fabulous news. And we're working on really pushing out clear messaging for our community, because that's what's going to get lost. And every time there's something weird about it, people drop off. So if there's any ambiguity in what the things are, so we will be super clear about what I'm waiting for Brandon to do that. No, I'm kidding. But we are doing that. So look for that in fall, early fall.
And we still provide vaccines here,
Yeah.
range of vaccines. I didn't see it on the agenda, so I wondered if you could speak to this because it's in front of us. I think it's helpful for the board.
Yeah, so Mandy and Micaiah put this together. So here's the policy. I think everyone was on the board when maybe not.
I wasn't.
Okay, well, here's the policy. And so at the last meeting, you had asked for a report, and Mandy and Micaiah put this together. This shows what so this pie is all of the purchasing that we have done. And then the 46% a year, or 2 years ago, whenever it was, fiscal year 24, shows that we had 46% were not in these categories. And now we're to 42% not in the categories. And then if you look at the last one, this shows you of the non-blue part of the pie, this shows you what percentage is in each one. I'm going to pass this down to so you can look
And
at
I
it.
assume that if this was only for half the year, that it represents half a year, because we didn't collect the data before then, right? It's just for that second half, because I don't think you would have been able to. So basically, this is all under our policy, which is helpful to know. My guess is it looked different even before the policy, but that's just based on anecdotal memory. So it kicked into place, it was 46%, and then the most recently finished fiscal year is 42%. And then what I see is a goal of going to like 38%. And obviously still with the prioritization that we have, that, you know, we're not pushing it to 38% and busting the bank, or, you know, working with folks who don't necessarily have positive record, where we have maybe negative experiences. But I do think, having worked on this issue for 20 years at the city of Urbana, which is the only place that doesn't have this at this point, it was like, we were the first to talk about it, the last to do it, I guess, is just how much I appreciate us doing this. And it's especially important as we see the cuts to SNAP and Medicaid, and to working people, being able to keep our dollars local as much as possible is really helpful. So, you know, I just think we spend so much money as public health that every dollar we can not spend on Amazon and we can spend here, as long as we're not breaking the bank. But I'll just tell you, a lot of people will match Amazon. So if you call them, like Best Buy, they will always match Amazon. You know, you can buy local and get a match. So we're gonna need to try to keep our money here so that we can we can keep jobs here and people, wages here, et cetera. And so I appreciate this because I think it really helps us,
And
focus.
when they're ready to think about it, the City of Urbana will have something put together, because I've asked them to put this together as like a model practice type of, because the real stuff is the paperwork behind the scenes that they're doing to evaluate all the different contracts and the questions they ask and that type of stuff.
Yeah.
So that would be useful then to give to other places if they're interested.
Would you all be willing to do like a 10-minute scheduled presentation to the city council?
Yes.
Yes.
volunteered you.
Yes.
Okay.
Worst case scenario.
I
there
think,
would be
actually, I honestly feel like somebody, being able to be like, here's what we did.
For sure.
I would be happy to participate because I help out in the piece, but like, I don't have to, but just being able to say, hey, here, it's not as hard as you think it is.
But then when you're done, start crying and say, it was terrible.
Anyway, I appreciate this, is very helpful, and it's helpful to set benchmarks and then see how we're, achieving those benchmarks, so. Yeah, and I think the main thing when I look at it is honestly just seeing if we can boost local, partly because of the precarity that we're facing, so.
Yeah, and I think local only meant Champaign-Urbana or Champaign County,
I know
right?
Champaign
It didn't
County.
mean like regional or
Yeah.
anything, yeah.
Yeah, absolutely. Other comments, questions? Okay. Old business, I don't think there's any old business, so we'll move on to new business with the treasurer's report. Aaron?
Hi. Yeah, as of March 31st, 2025, the balance sheet showed cash on hand at $7,178,160. Total fund balance at just over $8.3 million, representing 49% of our budgeted expenditures for the year. We ended the 11th month of the fiscal year with a surplus of $973,382. That's against a budgeted year-to-date deficit of $859,212. Our income statement showed revenues of $13,484,804, or about $1.2 million under the year-to-date budget, mainly due to contracts and grants being under their year-to-date budget by $1,361,682. Our total expenditures for the 11 months of the fiscal year were $12,511,422, or just over $3 million under the year-to-date budget. It's a mixture of personnel being under their year-to-date budget by $1.1 million, fringe benefits by nearly $700,000, supplies under their year-to-date budget by $220,000, and capital outlay under their year-to-date budget by $836,000.
Great. Team's healthy. Any questions? I'd entertain a motion to put the treasurer's report on file.
So moved.
Second.
Motion is second, any discussion? All those in favor say aye.
Aye.
Aye. Opposed? And carries.
I should have mentioned this in correspondence, but did you all get the email that was sent out to staff?
Yes,
Okay.
and we're gonna,
That was
to the
well-
best of our ability
well
without
received.
major cuts,
Yeah.
float salaries during the insanity of the federal government.
Correct.
With the hope that the midterms will help.
Correct.
That's not exactly how you would have
No,
been.
but that's what I was thinking.
Yeah. Okay. Next, I'd entertain a motion to approve payments to Board of Health appointees, Treasurer Ron Fields for June 2025 services, and Administrator Julie Pride for mileage reimbursement for county sites.
So moved.
Second.
The motion is second, any discussion? All those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, we have a review of the credit card statements. Anyone have any questions? Questions going once? Twice? Entertain a motion to put the credit card statements on file.
So moved.
Second.
We have motion second, any discussion? All those in favor say aye.
Aye.
Opposed? That carries. And next, we have approval of check request payable to Dell Marketing LP for Microsoft renewal. I'd entertain a motion.
So moved.
Second.
A motion is second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of training agreement with Parkland College. I'd entertain a motion.
So moved.
So moved. Second. Oh, God.
James. Motion and the second, don't know who is who, Amy can figure it out. Any discussion?
I'll be second.
Okay. Second, any discussion? DISC personality profile. What is DISC personality profile?
So you might want to describe it, it's kind of Myers-Briggs-ish in the sense that you come out with a profile and then your colleagues understand why you may be strange. That's how it worked with me, like they understand like why you're.
Why you are the way you are. So
Right, why you
communication.
communicate differently maybe than others and what it means and, so it's that kind of thing. It's a thing to help staff, communicate better.
It's for your, it's for your,
Mariah, you should do it.
it's for your leadership team.
It's for the whole agency.
Oh, the whole
It's
agency
for the
gets like
whole-
a,
yep.
gets tested and.
Yep, and the ones, who did it, the coordinators? Yeah, and they really liked it, correct? And they found out that Brandon is off the island.
No, well, my coordinators found out they each have a different assigned letter, so they all communicate differently.
Okay.
So that's,
It makes your job hard.
well, and it makes them relate to each other better.
Yeah,
Is this the trainer you had?
yeah.
Okay.
So it went so well that we decided to do it for everyone in the agency. And hopefully that will prevent hurt feelings or misunderstandings or something like that.
Okay, any other questions?
I'm just gonna ask, it's generally in the usual expense for team building, workplace synergy sort of things every so many years. As long as it is, I think this is great.
Well, we do,
Yeah.
we do all kinds of trainings all year long.
Great.
Yeah, always.
It's a lot of money, but it's for the whole.
It's for
staff.
the whole-
Yeah,
so-
the
yeah,
whole-
Yeah,
whole
it's-
entire agency.
Yeah, it's.
And then we're going to make everyone start wearing that monogram on their.
That'd be helpful.
Luckily, there's no way.
Any other discussion? All those in favor, say aye.
Aye.
Opposed? That carries. Next, we have ratification of check request payable to Imperial Servicing for security cameras. It's a 50% deposit that I paid, pushed through the system, so we can get it done, and this is a ratification under our policy for ratification.
So moved.
Second.
No motion and a second. Any discussion? If not, all those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of check request payable to Vermillion County Health Department for quarterly reimbursement for quarter 4 sub-award.
So
Entertain
moved.
motion.
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of check request payable to Kronos, sure for new UKG benefits modules. I entertain a motion.
So moved.
Second.
Motion and a second. What, is this HR modules?
It is,
Yeah,
it's
okay.
benefits. It was on the agenda from last month
Mhm.
and approved, and what it is replacing an older vendor that we have that we're not happy with. We're not satisfied with that vendor, so we're replacing them with someone else.
Okay. And they are doing your,
Benefits, employee benefits.
oh, they manage the employee benefits? Okay, for 150 people?
Mhm.
Got it.
Yep.
Okay, and this is for 1 year?
Yes, 1 year.
Any others? All those in favor say aye.
Aye.
Aye, opposed, that carries. Next, we have a check request, approval of check request payable to Wingo Construction for the fiscal year 25-003 new wall opening. I'd entertain a motion.
So moved.
Second.
Motion. Do we have a second? Okay, motion second.
And I have to say that that is very festive back there. We now have a glass sliding door, like a real thing. And it was something that, how many years since we moved in here? Since about 2007?
Yeah.
Been trying to figure out a way to keep that area closed off so the kids won't run back there and wander off.
I mean, as you go into where the bathrooms are in that part.
So the public bathrooms, now between the public bathrooms and the clinic area, there's now a sliding door
Okay.
that requires a badge to get through. So it's only for clients and
$29,000 later. Okay.
Yep.
Although,
It was also necessary because of our thing we have with having private areas where people can't get back to, like,
yeah,
or other.
yeah, you have to designate
Yes.
what is public and what is private, and put signs up.
Yeah.
Make it very clear what is public and what is private.
Yeah.
Put private on everything except a few things.
Yeah, but the problem there is you can just wander all the way back through a whole building without that being closed off. So now we have it.
Any other discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of check request payable to TJ Central for door installation. I'd entertain a motion.
Second.
Any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have, I'll take these next two omnibus, because I probably could have done all of them. Approval of check request payable to Davis Electric for fiscal year '25 electric work, and approval of check request payable to Wingo Construction for fiscal year '25 general contractor labor. I would entertain a motion for both of those.
So moved.
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of a letter to designate Julie Pride as the authorized signer for enrollment in Illinois funds. I'd entertain a motion.
So moved.
Second.
A motion and a second. Were you not a signer for Illinois funds?
Does it have to just be done again?
Are you just starting to use Illinois funds for the first time?
This is.
Right. This is the first time that I've looked that it's been 0.18% higher than the CD. So, I mean, there's really not much of a difference, but I figured if we do use it, being that close, then I also have availability of pulling the money out where I don't have that with the CD.
Yeah, so higher interest rate but more flexible money?
The interest rate is pretty much the same,
Okay. You said 0.8.
0.18.
Okay. Yeah, I mean, our experience with Illinois funds is it floats a lot, and so sometimes it can really be a boon. Like, we'll move money over to Illinois fund and have made good money in watching it carefully and sweeping things over, so I don't think it's a bad idea. Any other discussion? All those in favor say aye.
Aye.
Opposed? That carries. And we have pending grants for the administrator sign between CUPHD and IPPH for fiscal year '26 prep in the amount of $115,440 for the contract period of July 1, 2025 to June 30th, 2026. And we have another contract of CUPHD and IPHS for SOR, which is $539,944. Same period, July 1, 2025 to June 30th, 2026. I'd entertain a motion to approve the administrator to sign these contracts.
So moved.
Second.
Motion is second. Any discussion? What is SOR?
I don't remember what it stands for, but that's harm reduction, right? So
It's an arcane.
Oh,
Arcane.
great. We need $500,000 for
I know,
Narcan.
I don't know what SOR
Seriously.
stands for.
It's
Something
overdose response.
state overdose
State
response.
overdose response. It's overdose
State
response.
I will say that our street outreach worker used five Narcans that he received from public health to save a person's life who he thought had passed. This was 2 weeks ago or so, 2.5. And he revived and is still with us.
Great.
So thank you very, very much. We appreciate Narcan in our community. Any other discussion? All those in favor say aye.
Aye.
Opposed? That carries. Our next monthly meeting will be August 13th, 2025 at 5 p.m. With that, we stand adjourned. Thank you so much.
Mark stuff at the office.
We made it.
I got a couple from him. It's like you told me the story. I was like, I haven't seen it.
You guys can.
I have it in my backpack.
You guys can-